use of painkillers as well as antibiotics has been a subject of concern for a long time, especially since the COVID-19 pandemic. It has come to our light that a lot of people are actually using antibiotics as well as painkillers without rational indication. Especially for painkillers, the non-steroidal anti-inflammatory drugs get excreted through the kidney and can be actually toxic to the kidney. So unless there is a reason for you to consume these medications, please do not use them across the counter prescriptions and buy them. Always be guided by your doctor, especially if you have diabetes, especially people who are known to have kidney disease. And if you're going to take more than a couple of doses, it is very, very important that you should be able to monitor your system to see whether your kidney function is normal or not. Same stands true for antibiotics as well. Antibiotics, when prescribed, they should be taken in the full dose as well as the full course as prescribed by the doctor. And if they have not been prescribed, please do not self-medicate. Please do not go and buy them across the pharmacy and then consume them, because they are harmful. They actually promote the growth of multi-drug resistant bacteria and can be very, very dangerous if used unmonitored. So we need a system which needs to be monitoring both of these type of medicines. And it is very imperative that common people understand that these are prescription medicines not to be taken unless required. Thank you.
Patient safety is a very, very pertinent issue in today's healthcare environment. Both patients and doctors, providers are responsible for patient safety. It is important that we talk about patient safety because the primary intent or the purpose of treatment or any medical intervention is to bring benefit to the patients and to the individuals. But many times when there is gap, when there is miscommunication, there can be potential harm occurring in the healthcare environment or patient care provision environment. And both patients as well as providers are responsible for this. If we talk about patients' responsibility, we see there is a rising trend of self-medication. People used to or tend to use even painkillers or antibiotics on their own. I would like to warn, especially for painkillers, because painkillers can bring potential harm to your body. They can harm your digestive system, liver, kidney, almost all parts of your body. And this is not just short term, but also in long term and permanent basis. And painkillers are of different types. They are meant for different purposes, and they are different from the chemical composition point of view. So one cannot use same painkiller for different types of pains that we may experience that can occur in our day-to-day life. And don't take painkillers casually, because these are controlled medicines. These are to be taken only under the supervision of qualified medical practitioners. Also, we see, especially during our recent COVID pandemic, a lot of people are using azithromycin for common cold, which is not required, because this poses a big potential risk of antibiotic resistance. In future, we may not be left with any good antibiotic to treat microbial diseases in future.
We know that many people buy painkillers over the counter for any kind of pain that they might have. And this is possible because in the context of our country, there are several medications that need prescriptions but are easily available over the counter. This also happens because safe prescription practices are not followed by many healthcare providers. And many a time we see that medications that may not be needed for the person are also prescribed. This could be for several reasons, because the patients aren't happy and therefore the healthcare providers would like to keep them happy by giving them as many medications as possible, or there is an incentivization which promotes the use or prescription or writing practice of those physicians. It also happens because of lax regulatory systems, and therefore many medications that actually need a prescription are prescribed or dispensed without any doctor's advice. This also happens because of patients and caregivers' behaviors where they need instant relief, and therefore they simply approach a pharmacist or a pharmacy and buy the medicines over the counter, since they do not want to waste time by going to a doctor or spend money on a consultation. They therefore just walk into a nearby pharmacy and buy the painkillers. What they do not realize is long-term use of these painkillers can lead to adverse effects or harmful effects on many target organs on their body. And it is only when they land in trouble that they reach a physician and are then able to address the problem. There needs to be a concerted effort from all fronts to be able to address this. And most importantly, patients and caregivers need to learn what kind of medications are OTC and do not need a prescription, and what kind of medications are an absolute must with a prescription. Awareness amongst all stakeholders is also important, and safe prescription practices should be encouraged within the healthcare providers. Thank you very much.